in addressing this critical issue. Now I would request Professor Rai to address the August gathering. Thank you.
I hope nobody is going to mind that I do it from here, because I think everybody has small by design. So, thank you very much, Excellency, for giving us the time today. Thank you, the Chief Executive Officer and the Registrar who could make it in a very short time. The Registrar and the Dean International Affairs are also my long-suffering colleagues, because I do come up with very weird and abstract requests at very late hours, but they're always fulfilled. So thank you very much. And my gratitude to my boss, the Chair of Asia, who has a very busy schedule, but he found the time out to be here today. There's a lot that can be said about lead poisoning, but there is no point in getting into the technicalities and the abstract knowledge that is buried there. But I would like to make a point that I was having a discussion with the Chair of Asia also earlier in the day. Lead is a silent killer. We have known about it for around 50 years, and yet governments all across the world have not really been able to do anything about it, because how much lead do you get out of the system? It's the easiest way to make paint. It's the easiest and the cheapest thing to coat your houses, the toys, and every packing material that you know. India wants to fight lead, but also there is an industry which is the biggest exporter of lead along with China. So we have a situation of double whammy, sometimes a triple whammy, because everything that we see around us, people in their 30s, people in their 40s having a heart attack, we are looking at all the wrong reasons. We blame stress, we blame work at night, we blame lack of sleep, but the biggest driver, research after research has been pinpointing it, is that perhaps they are exposed to lead at a very young age. That is a point that we have known for 50 years, but we are not able to translate it into effective policy. We are not able to translate it into effective scientific rationale for governments, for people, for organizations to do. We have a visionary vice chair of Asia, Dr. Indu Bhushan, who has had many, many, many hats in his career, storied career like everybody in Asia, the chair, the vice chair, the members of the board. One of the things that he did in 2017 was to start promoting this knowledge gap around lead. And under his tutelage, I cannot take any credit, because most of the work that I have done under his guidance, and he's pushed me to do it by complaining to the chair more often than not, and then I have to do it, or else I will not hear the end of it. But jokes apart, it is a serious issue that needs policy solutions, which are not easy to come. We cannot offer a solution within 3 months, 6 months, 9 months, or a year. This will be a long, drawn-out conversation, but we have already made a start. Over the last 8 to 9 months, we have worked with governments, we have worked with people, we have tried working with schools, we have worked with universities to get the conversation on lead out. Because poverty kills, but it doesn't kill directly. It kills through various proxies, and one of those proxies is lead. If we are able to take it out, then perhaps more lives can be saved, more money can be saved in treatment that is not really needed or should not be needed. So that is what we are planning and proposing to do. With the help of AARDO and with the 31 partner countries, perhaps we can make a start in getting more and more people aware about what lead does. And you all have a presentation in front of you, because this is a question. I was recently in a meeting with a very important secretary to the government of India, and she heard me very patiently for 20 minutes and then said, don't you have anything other important things to do? Why do you care about lead? So now, what I've started doing is that anytime I go and meet any important secretary, I kind of tell them, you need to care about lead because of these following reasons. And that is what we want to do with the help of AARDO and under the guidance of the chair and the board of Asia, to get the conversation on lead to get the interventions on lead out and about. And I think that is the most important thing that I had to say today. So thank you everybody for being here, and I hope that very soon we are able to make or report some positive change in this direction. Thank you very much.
I'm pronouncing the names properly. It's a great, beautiful type of university with very modern type of infrastructure, I'm seeing. So well, this is a welcome from all these 32 governments which we are representing. And we are very happy that we are taking a very specialized thematic, which is, as Mr. Amogh said, that there is a gap in the knowledge. People are not even aware about that issue. As an organization, we are working a lot in community development, in agricultural development, in rural development. We call ourselves a manifestation of solidarity between Asia and Africa, because we are connecting nearly 2.6 billion people in these three countries, in these African and Asian continents. So from that perspective, we have been operating since 1962. The missions have been evolving also, because we started with a reconstruction mission after World War II. The focus was we had to reconstruct many of the communities at that time. And now after COVID, this is another era, we call it the pre-COVID era, now post-COVID era. After COVID, we realized there are lots of things to be done. We cannot tackle things without, increasing and enlarging our own network and partnership. This is why when Mr. Amogh approaches, we were very happy to open our network, open our arms and heart to give the facility, because we are not connecting to Asia as an institution. We are now connecting to the university itself. And we are trying a lot to connect all to academia. We know that problems will be solved in our member countries. In Asia and Africa, we've documented more than 30 different urgent problems. Call it from the agricultural perspective, from the livelihood perspective, from the woman perspective, from the youth perspective, and very, very serious problems. If we talk on the international front, we've committed as humanity, we have been committing to our SDGs since 2015. But now when we see the latest report of the UN Secretary General, we are a bit ashamed as human beings. We cannot even achieve the targets at that time. We are still having UN meetings everywhere. We are having many actors, many different stakeholders working on different programs. But overall, we are missing those targets. It's very aberrant, I would say abhorrent also, that having reached 2024, we are left with only 6 years for the accounting period. We see that we are lagging behind in even these basic type of things. We've committed to give food to people, to everywhere. Every mouth should be fed. We committed to poverty alleviation. So it's not an easy task. All governments, all policymakers have to put in the efforts. They have to walk the talk also. Finance also is lacking for this type of development. But here we are connecting especially for that area, which we have been working in water contamination for quite long. We have been dispensing some technologies to our member countries, especially those using those hand pumps. And in community, there are many diseases which have been caused by that one. There has been a technology invented in India itself. This is why I'm very happy to connect to academicians, and through Asia, this type of platform, we will be able to have the knowledge gap has to be decreased. We have to increase that awareness, make people understand, and at the later stage, or even simultaneously, we work with the policy makers. They have to understand that seriousness of the issue. As my good friend said, this is a silent killer. So we cannot allow the silent killer to operate in our society, in human society, in Africa and Asia. Now we are talking. You can have a larger mandate, but our mandate is restricted to this. But this is also the future of humanity, future of progress. we are connecting a huge population in Asia and Africa. We've got our figures, we are connecting only in these 32 countries to 2.6 billion people. If we talk about Africa specifically itself, is 1.4 billion people, just like India as one country. So you've got another continent. So creating the awareness in India is one. You can at one go through our own web network, we can create that awareness, we can implement a more or less, there could be some policy brief which could be worked out, and there could be some technology more appropriate to substitute those type of harmful elements which are already there. I'm not from a scientific background, I'm an economics by background profession, but I do understand that we have to bring in that technology, the science and academia to solve any of these economic and social problems. Political problems can come in later on, but the economic and social problem, the viability of those interventions and the policies have to be looked into. I'm very happy with my colleagues, also Dr. Behera and Mr. Kamal here, and all my colleagues here at AARDO. We've got my Assistant Secretary Regional, he's from Jordan. So we are connecting Asia and Africa. Whatever will be done in after following our MOU, we will try to have what we call pick up the low-lying fruits so that we go fast. Our own visibility has to be increased, as rightly pointed out by Honorable Najeeb Jung when we had a small discussion. The visibility of our intervention, the visibility of this MOU also has to be given to other countries and other policymakers. I'm very happy also because this is happening at this moment. Very shortly we are calling our ministerial conference where we are expecting 32 ministers from our governments to look into our own development strategy and all this type of planning. We usually work on a 3-year planning, but this one, given the importance, and I could easily understand that because I've been working, we work with lots of communities, with lots of women, and this is indirectly not only the seriousness of the issue has been highlighted. I think this is a very good presentation, but I think the blockage for the future development, we are preventing the resources, which are human resources, to develop their own potential. It's a block, it's a fine we are putting by using this type of lead in so many projects. And I do understand also that, I don't know, the research have been working on the IQs. IQ levels of people also will be, hampered or being hampered by this one. It's a really serious it is a serious problem where progress has not been happening as it should have happened. Because our duty now is to put this high on agendas, on all our meetings, sensitize people, get technicians, bring appropriate technologies, and try to sort out, at least help in sorting out that problem. We are very happy again to be connected to Asia. We will be very happily supporting and sponsoring some of the research if it is required. We've got some limitations. We usually have funding up to $50,000 for implementation of small projects. So that also can be put at the disposal of certain research or whatever findings we'd like to intervene. And as we discuss, high-level seminars, international roundtable can also be organized through our signature of this report. And obviously with the backing and support of the university also, we'll be very happy to work there. We had a few discussions on how we can expand with the university. We'll be looking also forward to have that expansion and maybe to have a further discussion with the university itself, how your researchers, your own lecturers can assist in overall development of Africa and Asia in the rural communities. Targeting rural communities, we are doing a great job in the sense that we've got documented India itself and Africa and many of these countries will live in villages. So some places we've got 75% of the population living in villages. So having development happening in the urban areas is one thing, but if you want to reach to all these nooks and corners in these countries, we'll have to ensure that there is proper development, there is proper science, there is proper knowledge being which trickles down to that level. We are, our existence is more than 60 years, and based on that, we've been able to bring together on one platform various technologies which are helpful but we have never been working on this type of things. So we are looking forward also to have policy brief, policy guidance, and technologies, and even research and projects. So in a summary, these will be the things we are looking forward to. Thank you.
Thank you. Thank you.